Now we're going to look at our signs and symptoms of liver cirrhosis. In the compensated and early stages, the symptoms are more vague and milder. The first one is intermittent fever. It will also have indigestion and dyspepsia. And dyspepsia is the term that refers to bloating, discomfort, burping, or it does describe indigestion as well. They'll also have telangiectasis, and that is also called spider angiomas. And I like to draw a little spider next to this so I can remember that telangiectasis means spider angiomas, and that's a dilation of tiny capillaries that make this burst appearance on the patient's skin. Now, the telangiectasis is thought to be caused from an inability to inactivate the hormone estrogen. So that means that the liver cannot process the estrogen, and it just makes these vessel capillaries burst. Now, I like to relate it to the fact that they don't have the blood clotting factors, and it makes bruised looking things come out on their arms. So I try to think about it in that concept, even though that's not the reason why. I try to think about it like that. Now, the other reasons, the high estrogen levels that these clients will have also produces what we call palmar erythema, which just means red palms. So the blood is really near the surface of the skin on the palms and creates a red appearance. Now, these patients will also have right upper quadrant abdominal pain, which makes sense because that's where the liver is located. So right upper quadrant pain. These patients will also have epistaxis, so nosebleeds, and we can contribute that to the inability to clot blood as much as a normal person would. So their blood's a little thinner than normal. They can't make the blood clotting factors or proteins to help manage that. Hepatomegaly is an enlarged liver, and splenomegaly is also enlarged. So if you think about the liver helps to process pathogens and things. So if it's not functioning correctly, the spleen actually produces a lot of white blood cells, and the spleen swells from the excess white blood cells. They will also have dependent edema. With dependent edema, the cirrhosis slows the normal flow of blood through the liver, so it increases the pressure in the vein that brings blood to the liver from the intestines and spleen, and the swelling in the legs and abdomen start to appear. The increased pressure in the portal vein can cause fluid to accumulate in the legs, causing edema, and then the abdomen causing ascites. Now, moving on to the late signs and symptoms. One of the typical signs and symptoms of cirrhosis is ascites. And the ascites is the third spacing of the fluid moving from the tissues and the spaces into the peritoneal cavity. This creates a shortness of breath for the client because of the pressure that the fluid puts on the diaphragm makes it difficult to breathe. The shift of fluid can also create a pleural effusion where some of the fluid moves towards the pleural space and creates a pleural effusion there, and that also will create shortness of breath for the client. Another typical description of a cirrhosis patient is jaundice. In jaundice, we see on the skin, eyes, and inside the mouth. They'll be very fatigued. They'll have nausea, weight loss, and muscle atrophy. The client will have a consistent mild fever, whereas in the early symptoms it was just intermittent, but this time it's mild and it is consistent. The client will also have fingernail clubbing and white nails, and they'll also start to develop petechia or purpura, and it's from easy bleeding and bruising, and when you press on it, it does not blanch. Let's look at a few more symptoms. Tremors, the patient will experience tremors, and the patient will experience pruritus. Pruritus is severe itching. It's related to bile salts. So an accumulation of bile salts close to underneath the skin. Sometimes the patient will also have jaundice at the same time. And that accumulation of bile salts produces excruciating itch that just cannot be cured. Now let's move on and look at some complications. These are also included in the signs and symptoms of liver cirrhosis, but these are going to be more along the lines of complications, just things that they have to deal with as a result of their liver cirrhosis. So the first one is portal hypertension. And when we look at portal hypertension, portal means related to the liver, and hypertension means high pressure. So we're going to have high pressure in the portal vein of the liver. High liver blood pressure or portal hypertension is the primary reason for complications and death in patients with advanced chronic liver disease called cirrhosis. The liver has two blood supplies, one directly from the artery and a second blood flow from the portal vein. Both of these feed into the liver. The greater portion of the blood comes from the portal vein, which drains the blood, listen up, from the abdominal organs, the stomach, the small and large intestines, the pancreas, and the spleen. Now, portal blood brings nutrients and hormones from the GI tract, which are important for liver function, homeostasis, and of many other bodily functions. But after arterial and portal blood mix and the flows goes through the liver, then it returns to the heart via the main vein in the body, the inferior vena cava. Now, liver disease has a profound effect on this blood flow. All chronic liver disease leads to scarring or fibrosis. When it's due to a virus or alcohol or fat, the scar tissue accumulates in the liver, and the most advanced stage is called the cirrhosis stage of it. So it's really fibrotic, it's tight, it's not spongy anymore, it stops the liver blood flow, and as a result, the blood pressure in the portal vein increases. And that's what we call the portal hypertension part. The increased pressure causes a certain type of vein dilation, similar to varicose veins or hemorrhoids. The most important one is called esophageal varices. These are dilated veins in the esophagus, and they can burst and cause catastrophic bleeding, which will lead to death very quickly. Another result of the increased pressure or the buildup of the fluid in the abdomen outside the organs, and they call this ascites. Now, the increase in pressure also results in other additional vessels opening up that allows the blood to bypass the liver, skips the liver completely, and goes back into the systemic circulation. Toxins that are normally removed by the liver gain direct access to the rest of the body and the brain, causing mental problems such as lethargy, confusion, and in the worst case, coma. So here's where your ammonia level is going to build up and lead into hepatic encephalopathy, which we'll discuss on the next slide. If the portal pressure is decreased, the outcomes of the patients are improved much. Now, with portal hypertension comes esophageal varices, and those were the dilated vessels over here on the right-hand side because the cirrhosis scars and clamps the vessels off, so the blood backs up through the vessels along the gastric wall, and then eventually they come out to the esophagus. So here we see bleeding esophageal varices. Your signs and symptoms of that are going to be hematemesis or vomiting blood, and it may also have melena where it comes out in the stool. Caput medusa is another symptom of the portal hypertension, and these are dilated vessels or varices along the abdominal wall. That's directly related to the liver cirrhosis and the blood backing up into that system. Now, don't you think that it looks just like Medusa, the goddess? So I just like to think about it like that from Percy Jackson and the Lightning Thief, and it kind of is a little similar. Okay, well, now let's look at some treatments for portal hypertension. The first one is a TIPS procedure, TIPS. It's a transjugular intrahepatic portosystemic shunt. And what it does, it creates an artificial channel or like a tube within the liver that helps the blood flow between the in vein and the out vein. So it helps the blood flow through the liver. The next one is beta blockers, and the drug of choice here is propranolol, also called Inderal. It helps decrease the portal hypertension. And then we can also help the client by instructing them to have a low sodium diet, and that'll help keep some of the water weight off. Now, the most severe complication is hepatic encephalopathy, also called HE, and it is a severe form of liver cirrhosis. Hepatic encephalopathy happens when the ammonia levels begin to get too high and start to affect the brain. So then, therefore, we'll have increased toxins in the brain, and it'll manifest itself with cognitive problems. So we're going to see memory loss and a change in mental status, confusion, stupor, and some asterixis.
This video will introduce you to asterixis, also known as the flapping tremor, and it's seen in various conditions such as cirrhosis, hepatic encephalopathy, opiate overdose, acute liver failure, and Wilson's disease. What you're going to want to have is your patient in front of you with their wrists extended, back like so. The physician will then take their hands and push back on the patient's hands, further extending them, and look for almost like a clonus type movement, an uncontrolled flapping tremor, which may be symmetric in both hands or asymmetric.
The next symptom of hepatic encephalopathy is factor hepaticus, and the name of the word means death breath. With a little swish and flick, hepaticus, death breath. Woo! Okay, well, the next step is that if we don't treat the hepatic encephalopathy and we don't treat the high ammonia levels, the patient will eventually become coma, and then death will be soon after that. So in order for us to help treat the high ammonia levels, we will give antibiotics, and that will help decrease the ammonia levels. It works by getting rid of bacteria in the GI tract, and then when the bacteria in the GI tract, it gives off a byproduct of toxins and ammonia, and that can't be filtered out by the liver anymore. So the antibiotics will help with that.